Dr. Natalie Marks, and we're here with a quick cup of knowledge. Joining me today is Dr. Donna Raditic. She's a boarded veterinary acupuncturist and nutritionist, and she's a consultant now with a very unique integrative approach. So thanks for joining me today.
Thank you very much.
There's a lot of hot topics, I think, in nutrition today, but one of them we were just talking about, if we can just jump right into it, is the topic of raw diets.
Yes.
We were just kind of getting your opinion. I'd love to hear a little bit more about what you feel really our practicing veterinarians should be thinking about.
Actually, a big part of my career was in general practice, and because I started doing acupuncture, obviously I got a lot of clients who are very interested in looking at diet and unconventional diets. So for me, as I've gone forward and become a boarded nutritionist, I do realize there's concerns, and I think general practitioners are aware that there's concerns with salmonella and listeria. And I think when a client comes in and talks to veterinarians about feeding raw diets, it is important to discuss those types of problems and make them aware. There are definitely websites that you can direct them to, and there's definitely AAHA and Delta. A lot of them have, won't accept dogs who are being fed raw. But I also feel we don't know what the perfect diet is or the ideal diet is. So I feel it's important to keep an open mind and also to listen to clients. And a lot of clients, one survey that was actually published stated that a lot of clients who feed raw aren't consulting us as veterinarians about nutrition. They're afraid to discuss that with us. That concerns me because you don't even get the opportunity to have that conversation. Right. And in that study, they had over 2,000 responders. 84% of them were college-educated pet parents.
Wow.
So that takes you back a step. This isn't, and this is a growing market. So I think being open-minded, realizing we don't know everything about nutrition, we don't have all the answers, we don't know the ideal for every pet, or do we do for every human? So I try to keep an open mind so that they're comfortable discussing with me and we can talk about pros, cons, why, what's the best for their dog. I like to treat them with respect, and I also like to deliver the best nutrition to that dog or cat as an individual. So I keep my mind open.
I think it's great advice. I think a lot of graduating students and young practitioners find there's a lot to discuss in that standard annual exam,
yes.
Right? What advice do you give to these practicing veterinarians about how to make sure nutrition is always discussed and it's almost sort of that fifth vital sign?
Right. I think in very short time periods it's hard to delve into because sometimes I think a lot of practitioners are afraid to take that step and get into nutrition because pet parents can be very passionate about nutrition. It's a hot topic, like you said, it's a hot point. But I think it's important to find out what the dog is eating, ask them. And if they really do have an interest or there's a lot of questions, there's nothing wrong with offering them another office call, another time where you can really evaluate. Maybe get a form together where they can put the information about diet, how much they're feeding, what their concerns and questions are, and then schedule that appointment. And that will sort out what clients really are passionate and which clients are like, oh, I think I'm okay, doc. But those clients that are passionate, it gives them a time to come in and really talk to you about nutrition. And it also will build up your skills to be able to talk more comfortably about nutrition, is setting that time to really address their concerns and for you to investigate diets. A simple way, though, to evaluate food is ask them what the diet is, hopefully maybe even ahead of the appointment if you can, or you could do it as a follow-up. Make sure that the diet hasn't had a recall problem. Most times, many good pet parents know that before we do, right?
That's true.
Second thing is, what does the AAFCO statement state? Is it AAFCO approved diet? Okay, then you know it's complete and balanced with the vitamins and minerals. And then how does that profile look? Is it a diet that maybe is what we call the AAFCO all life stages, which is a diet that can be fed to an adult and a diet that can be fed to a puppy, which means it's going to be very calorie dense. And we know the number one nutritional disease right now is overweight, obese. So maybe that dog should not, who's at risk for those overweight, obese, might do better not on an all life stage diet, but more an adult maintenance diet. So those are three quick things. Recalls, is it an AAFCO approved diet? And is this maybe a diet who has too many calories? I think those three things could be done very quickly in an appointment.
Those are great tips.
Yeah.
You mentioned also, again, the most common nutritional disease right now, per se, is the dog that's overweight or obese.
Yes.
I think a lot of practitioners, just sort of like nutrition in general, sort of back away from that topic because they don't know how to approach a client without maybe offending them.
Right.
How do you approach those pet parents where the pet that's coming into seeing you, whether it's a dog or a cat, struggles with being overweight or obese?
I always try to keep a sense of humor, so I basically say your dog is fat. Or your cat is fat. And guess what? I'm getting fatter too.
Oh.
You know?
Yeah.
None of us are perfect. And I'm there for your dog and your cat, and we can have a laugh together. Yeah, I'm getting, and then they're like, well, I am too. And I'm like, yeah, I wish I was 20 again. And, you know, we go through this whole lamenting back and forth. But then I just say to him, I'm here because, and I'm mentioning it because we know all the diseases that happen concurrently when your dog is overweight and obese. And it's okay, I'm still gonna eat my Snickers bars, and I'm probably still gonna gain a few pounds, and I know I need to hit the treadmill, but I want your dog and I want your cat to live longer, and I know you want that too. I know you do. I became a veterinarian because, yes, I love animals, and guess what? I still love animals. And we want them to live long, healthy lives, and the way we can do that is by keeping them trim. That's one thing we know for sure. If they can stay leaner, they can live longer, better quality of life, and we can get rid of a lot of problems that can come up, a lot of diseases, orthopedic osteoarthritis, pain, skin problems, bladder issues. A lot of that has been associated with overweight, obese. Just like you, when we're overweight and obese, it's a pro-inflammatory state. It's the same for them. But this is something we can do together, you know?
Yeah, and I think that's also a great way to instantly bond that client to you, right?
Yeah.
Because we've talked about there's a lot of pet parents that aren't consulting us for nutritional advice. So as a consultant, if you're going into a practice or a group of practices where they feel they don't really have a good pulse on nutritional counseling, what are a few things that you suggest to them to sort of regain that trust from the client?
I think finding, if you have a multi-doctor practice and technicians, find somebody who's got that passion, you know. It's probably a young millennial veterinarian or a younger technician who's, you know, rating everything and very conscious about their own food awareness and things like that. You know, finding somebody in your practice who has that and letting them kind of take the ball. Let them start simple. Attending CE conferences like this, you know, where we're talking all day about nutrition, joining groups. There's an American Academy of Veterinary Nutritionists, providing them tools and time. Let them do the extended. Mrs. Smith, I know you want to talk about more than we've talked about with the diet. You know, Dr. Cook does that. Why don't you set up with her? She has some evening appointments where she goes and does nutritional assessments. And I'd love to have you see her because I know your last Golden didn't live as long, and I know you want Buddy to be on the best food and live a long, healthy life. I know Goldens they get pudgy so easy. Dr. Cook is great at this, you know, or let my technician, get our technicians involved in this. It has to be a team effort, you know, and usually if one person who's got that fire, you know, that energy about talking about nutrition, and they're gonna go in there, and you know, I did it too. I made some mistakes and I learned and I went forward. But then once you get rolling, that information starts to disseminate and your whole practice starts to get aware. So pretty soon, Dr. Cook may be the specialist or the go-to, or you know, Judy the technician is going to be the go-to nurse to be monitoring your weight loss, but everybody starts getting that idea how important nutrition is. We shouldn't be afraid of it. And it is a hot topic, but I think what I've learned more than anything, since it's a very challenging topic, it's made me a better veterinarian. Embracing that challenge rather than, oh, I don't want to go there. You know, let's embrace it and get these discussions out on the table and talk about it.
Well, you're really inspiring, and I think you've given a lot of really great pearls to the practitioners listening about and how to really embrace nutrition and make it a central part of practice. So I really thank you for your time.
Thank you.